Have patient remove all metallic objects from head and neck region such as earrings and any piercings. If applicable, have patient remove any partial or full denture. Step 2. Log on to EagleSoft and select the patient's name you will be working with. Then select the X-ray tube icon. Once here, select New Exam and then select KAVO Panoramic. Then in the upper left, press Acquire and you should see a green illuminated screen. The next step is to place all appropriate barriers. Start with placing the sticky barrier on both handles, both temple rests, the forehead rest, and the chin rest. Next, place a clear plastic sleeve over the patient's bite block. This should be your final product. After placement of the barriers, fit the panoramic machine to the patient. Have the patient step forward and place their central incisors into the notch on the bite block. The first step is to select the patient's size. Once the size is selected, adjust the panoramic machine to fit your patient's height. Then turn on the laser lights to fit the machine to your patient's anatomy. The horizontal line should be lined up on the lower portion of the orbit. The vertical line should go directly down the patient's midline. The focal trough should be lined up with the patient's maxillary canine when they smile. To adjust the focal trough, you can turn this knob here. Once patient is aligned correctly, tighten the headrest around the patient's head. Then have the patient hold on to the handles and take one big step forward. Once the patient is in this position, inform them to swallow, placing their tongue to the roof of their mouth, and then hold still until told otherwise.
Press and hold the button and look in the mirror until you see the piano machine stop moving. Before you leave, make sure your piano is diagnostic and make sure that none of these positioning errors have occurred.